Hello everybody, this is Hassan Nafid. I'm an anatomy and physiology instructor at Madison College in Wisconsin. I wanted to welcome you back again to our anatomy sessions, and I want to start talking about the special senses. In this session, we're going to talk about the eye. The eye occupies the bony part of the orbit or the orbital bone, which is this part of the skull. The eye is about 2.5 centimeter in diameter. It is a sphere shape. Only 1/6 of the eyeball is visible. The remaining 5/6 of the eyeball is inside the bony part of the orbit. Looking at the eye, the external surface of the eye, you will be able to identify that transparent layer of the eye. This is known as the sclera. The sclera is lined up with a thin membrane known as the conjunctiva. That conjunctiva will go and lines up the inner part of the upper and the lower eyelids. Also, the anterior part of the eyeball is lined up or covered with the cornea, and the cornea is a tough fibrous layer that protects the eye and gives its shape. Also, in the eye, you will find eyelashes, and these eyelashes will cover the eye and protects the eye from dust. The conjunctiva will secrete some secretory substance. This substance will protect the eye, it lubricates the eye, and it does have antibacterial action that protects the eye from infection. And that's why dry eyes will make the eyes susceptible to infection, which you see sometimes. Besides, dry eyes also will predispose to a condition of conjunctivitis, or what we call pink eye. This can be a bacterial conjunctivitis, or it could be just dryness, which we call keratitis or keratoconjunctivitis. I want to show you the anatomy of the eye from outside. The eye has 3 layers if you take a look at it. If you take a look at this layer here, I'll share with you, show some light here to show you. This white layer you see outside and is found in the kind of surrounding the whole entire eyeball. This is the fibrous layer of the eyeball, and it includes the cornea and the sclera. The middle layer, if I take this cover out to show you the middle layer, this is the vascular layer of the eyeball. And this is the layer where you find the iris and the ciliary muscles and other veins and arteries that runs on the surface of the vascular layer of the eyeball. If we open this further, we will see the inner layer of the eyeball, and this is the neural layer where you will see the retina and other part of the optic disc and the macular and the retinal venules. As I explained, the eye is divided into 2 chambers that are divided by the lens: the anterior chamber and the posterior chamber. The anterior chamber is in front of the lens, while the posterior chamber is behind the lens. The anterior chamber contains a clear, watery solution. This is known as the Equus Humor, while the posterior part, which is behind the lens, is filled with a gel-like substance. We call it the vitreous humor or the vitreous body. The Equus Humor is continuously formed by the capillaries of the ciliary body. It helps to maintain the intraocular pressure inside the eye, keep it in balance, and provides nutrients for the avascular lens and the cornea. As you know, the lens and the cornea does not contain blood vessels, so they get their nutrition by diffusion from the fluids. Aqueous humor is reabsorbed into the scleral venous sinuses and a drainage duct located at the junction of the sclera and the cornea. If we looked at this model here of the eye, I wanted to share with you and show you this model of the eye right here. I'm going to pick it up a little bit to show you other parts of the eye. If you notice here, this part here, which is known as the eyelid, this is known as the superior tarsus of the eyelid. All right? And this is the inferior tarsus of the eyelid. As you notice here, you see this strap of muscle that I'm going to tip it over a little bit for you so you can see what I'm talking about. You see right here, emerging from that is the tendons of the levator palpebrae superaris muscle. This muscle helps to raise the eyelid in the upward direction. It raises the upper eyelid. So this is a tendon of the levator palpebrae superaris. This is the lacrimal gland, as you see, and this is a gland that secretes tears. It is found on the lateral side of the eyeball. If you look at this eye, this is the nasal side, while this is the temporal side. So this is the lateral side, and this is the medial side. We can call that the nasal part and the temporal part of the eyelid. I wanted to tell you the eye moves by straps of muscles. These straps of muscles hold the eye, if you see it here in this model. The straps of muscles, they hold the eye. I'm going to turn it all directions so you look at it. Lateral and medial, upper and lower, and even there is more oblique muscle. There is 6 straps of muscles. These straps of muscle direct the movement of the eye. So when we look lateral or medial or up or down, these muscles move the eyeball and enable us to look in different directions. We're going to name these muscles one by one. So here, I'm going to take this off first to show you and explore these muscles. These are taken out. So what you see here, this is the superior rectus muscle. This is the lateral rectus muscle. And this is the medial rectus muscles. This is the inferior oblique muscle. See it from here. This is the inferior oblique muscle, and this is the superior oblique muscle. It's a little hard to see. I have to turn it this way. Actually, this is our superior oblique muscle. In the back here, this white cord or white structure, this is the optic nerve. And if I open just a little bit here to show you, you're going to see the same structure of the eyeball with the vascular layer. And in the back here, the back of the eyeball will emerge the optic nerve fibers. And these fibers runs to the back, and they will go to the brain where they relay on the occipital part of the brain. And this is a part of the brain that is responsible for interpretation of visual impulses. I wanna go with you over the eye muscles. We're gonna use this model also, which is a little bit clear. So this is our superior rectus, and this is the inferior rectus muscle, the bottom. On the side, if we talk about this as the lateral side, this is going to be our lateral rectus muscle, and this is going to be our medial rectus muscle. This one that goes diagonal this way, this is going to be our inferior oblique muscle. And the superior oblique muscles, we looked at it in that model. The lateral rectus muscle moves the eye laterally. Lateral rectus muscle moves the eye laterally this way, and it is supplied by the abducens nerve or the fifth cranial nerve, while the medial rectus muscle moves the eye medially. So it moves the eyeball medially that way. If you think about this is the medial, so it moves the eyeball this way. And it is supplied by the third cranial nerve, which is known as the oculomotor nerve. The superior rectus muscle, in the other hand, elevates the eye and turns it medially. So it elevates the eye and turns it medially. And it is supplied also by the oculomotor nerve or the third cranial nerve. The inferior rectus muscle depresses the eye, so it turns the eye downwards and it turns it medially at the same time, so downwards and medially. And it is supplied also by the oculomotor nerve. The inferior oblique muscle, this muscle elevates the eye and turns it laterally. And it's also supplied by the oculomotor nerve. And the last muscle is the superior oblique, which is seen here in this model. Move this a little bit. Here's the superior oblique muscle. Here, this muscle depresses the eyeball and turns it laterally, and it is supplied by the trochlear nerve. So, to summarize, all the eye muscles, we can say, are supplied by the oculomotor nerve, except two muscles that are supplied by the abducens nerve and by the trochlear nerve. And these are the superior oblique, which is supplied by the trochlear nerve, and the lateral rectus muscle, which is supplied by the abducens nerve. Looking at the eye from outside here, from the exterior, you will notice the presence of the opening in the front of the eye, and this is known as the pupil. The pupil will permit the passage of light, and it controls the amount of light that gets inside the eye. And this light stimulation will be carried, or actually refracted, to the back of the eye, and it is going to be projected in the retina, and from the retina will be taken by the optic nerve, as you see here, and interpreted as visual stimulation, and the image will be interpreted, as we said, in the brain. One of the diseases or problems that we talk about, the physiology of the eye and the pressure in the eye, is glaucoma. It's one of the leading causes of blindness in the US and worldwide. This is a disease that will increase the pressure inside the eye. Eventually, the optic nerve will be pressured, or the optic nerve will be damaged, and unfortunately, this damage, if not detected early enough and treated, can be permanent and can be a cause of blindness. It is easily detected, diagnosed by regular examination and checkup of the pressure in the eye, and probably some treatment. Thank you for watching this video, and I'll see you in the next video when we talk about the ear. Thank you.